Hey guys, it's Ted Bogert. Welcome back to the TED Show. I am so excited to have my dear friend, incredibly talented doctor on the show. We have Dr. Shweta, don't be a hater, with GAYA Wellness. Welcome back. How are you doing today?
I'm great. Thanks for having me back, Ted. It's great to be here.
I am so excited to have you, and sorry about the cough there. You are launching something new. You have just launched it. I know you from being a great friend and a great community leader. So I want them to learn about you before we learn more about GAYA Wellness. So take it away. Give them a little 411 on you.
Awesome. So I actually first came onto the show a couple of years back when I just moved down to Orlando, and you had invited me on, and it was such a great honor to be here because I actually didn't really know a lot of people, and I was just sort of diving into the real estate side of the community and also starting my own practice at that time with my previous employer. And so things were very new, and being on your show was an excellent way to catapult myself into the community and, really get to know a lot of members that are who's who in the real estate side of things, as well as making relationships with women who are very powerful and active leaders in the community as well, which then subsequently helped me with my practice. And I'm a gynecologist by trade, so making connections with women is kind of helpful. And so it was great. And subsequently, as the years progressed, I continued to grow my practice, and I started to get working on this idea of my current launch when the pandemic actually hit. We were obligated to see patients in the virtual setting because of the pandemic, and wanting to still provide care for my patients and keep in touch with them, especially the pregnant patients that we had, and not being able to see them in person because of the contact precautions that we were living through. Gosh, it seems like it was a million years ago, but I mean,
It does, doesn't it? It
yeah,
really does.
another lifetime. But that was really just 2 years ago, and that prompted the idea of, well, after things started getting better and we were back to seeing patients in person, I kind of thought to myself, why are we doing that? Not because it's convenient for the doctor, but it's really convenient for the patient when they can actually have the option of making a visit and being able to finish it virtually. Especially for moms with children, they have to figure out childcare, especially for the active woman who is working full-time or has daytime hours for her job. And just in general, in today's hectic, chaotic world with traffic and limited time off and all the things, moving back into the in-person setting just seemed like a step that we were taking backwards, just because that's what we were used to,
Yes.
as opposed to because it was really what's best. I think they said, like, in the time frame of the pandemic, the smog over LA actually improved significantly
Crazy.
because people were working from home, and a lot of companies reverted back to working in person, and I think it's very independent. It's very dependent of what company, what industry you're in, but I think some companies just went back to working in person because that's what they did, not because it was necessary. And it again makes you wonder, like, are we doing things just out of habit, or are we doing things because they're truly what's the best way moving forward for us, for the people we provide services to, for the environment even? And so that's kind of what prompted this next adventure that I am embarking on. I am a huge advocate in women's health and in educating women about their health and empowering them to make better choices, to become healthier, and to be able to provide a service that is not limited to them physically being somewhere in order to get the care they need, and not limited to the kind of insurance they have, providing a service that's affordable yet high quality, high boutique and level of service, but making it accessible to everyone and anyone from anywhere is what GAYA Wellness is about.
Well, it is innovative. First of all, kudos to you, because I feel like we all had experienced telemed, right? Even a little bit before pandemic, you go on a telemed, but it was basically if you had, a cold. This is pre-COVID.
Right.
People. You went on sinus infection maybe. So I was sharing Gaia Wellness with several people, including my daughter, and my daughter is what I would consider a millennial. And she said, "Oh my God, that's amazing." And then immediately stopped, as did everyone else, and said, "How is that going to work? I love it, but Dad," and I go, "I know, I don't need the visual. I get it. But explain that, because I think that's something I know people love the concept, and I think it's good to educate them on how that would work. Obviously, there has to be some things that you have to come into the office for.
Right. Well,
But
I mean,
how would they utilize the virtual appointment?
so you would start off by like kind of stretching with your phone so that you can reach down there and actually, I'm kidding.
I'm I'm gonna need a cocktail. Woo!
So
You know what?
no, this is not.
Nothing surprises me in this world. So
And
I love it.
frankly, I think we get a little intimidated by the concept of having telehealth for the vagina, because it seems like such a big no-no. But I think in the future we're going to get there, because I think we are all realizing that there are some barriers in the way our mindsets are in terms of how we perceive things, and we're stuck in that way. And I think the world moving forward is embracing things that are not in a certain box like we're used to, whether it's gender, whether it's sexuality, whether it's the part of the anatomy. We are becoming more and more embracing of what we are and how many different shapes, sizes, names, and identifiers that comes in. And I think just like we can show someone, our ailments, like our skin ailments, on a telehealth visit, no one has any concerns about showing that bump on their shoulder or that mole or anything along those lines. And I think at some point, maybe a little bit further in the future, but we'll probably get a little bit more comfortable with that concept. Right now, we're not there, and I acknowledge that. And this is not something where I'm going to be doing actual direct to vagina telehealth. I will still be talking to my patients above the equator. And the understanding behind that is, women's health is not just her reproductive organs, or to simplify it, it's not just her vagina, though that is what a gynecologist is often, limited to being associated with. I personally have never practiced that way. Any of my patients could attest that I will address their entire health. I just think that a woman's wellness actually is not going to be identified with one part of her body. Likelihood is that if she is not sleeping well, if she's not eating well, if she's not, happy with her relationships, it's all going to affect her gynecologic health as well. I've had women who will have yeast infections because they're under so much stress at work, and not having that opportunity to talk to them, develop that relationship with them, find out like what's actually going on is it's shortchanging that woman from a true health experience. And just saying, oh, okay, great, your vagina looks like it has a yeast infection, here's a medication, I'll call me back when it's improved. That's a very archaic way of practicing. And I think
it's so
that
micro. It's
right,
not the whole body. It's not the whole
no forest
picture.
for the trees there.
Yes.
Exactly. And there's no time there to explain why that one part of her health is affecting the other part of her health. There's no opportunity to explain why this treatment that we're recommending is actually going to be effective, or why what they thought they were using was going to work and didn't, and may have made things work, why it wasn't effective. These are the kinds of things that prevent a patient from making the same habitual like behavioral tendencies that make them prone to certain kinds of medical conditions. But if you don't explain it, if you don't have that time, then that education is not going to happen, that learning is not going to happen, that health improvement is not going to happen. You're just giving them medication and putting a Band-Aid on the issue. But it is virtually impossible to have that length of a conversation or that kind of a relationship in the in-person setting, because most doctors are seeing up of 30 to 40 patients. I know providers who see 60, 70 patients in a day. And in an 8-hour day, that renders about 5 minutes per patient. And you have to do a physical exam in that. So there's really no time other than to be like, hi, is this your name? Great. Yes. Scrotum, that's the swab, that's the treatment, see you later. Leave me a 5-star review. And I didn't grow up in a medical environment that services like that. I truly believe in the art of medicine. I believe in that patient relationship. And so seeing how much we have started to chip away at that art in medicine because of the lack of time, because we have to see so many patients, and we have to see so many patients because healthcare is expensive and we have to get to the bottom line. And it just snowballs into a problem that can be addressed by actually taking the part of the visit, which is getting to know your patient, developing that relationship, understanding their background, understanding their questions. That actually doesn't have to happen in the face-to-face. And in fact, it can happen a lot more comfortably and conveniently for a patient in their own home or in their own, environment where they feel comfortable, secure. They're not worried about, like other people walking by or the noise in the hallway. They're not worried about making it to carpool pickup on time because the doctor is running late. There's so many elements that can affect the quality of a woman's experience in a visit. And I feel like being able to do that in a virtual platform makes it so that it's on her terms, on her turf, and more time to actually do the connecting and do the education and the explaining. And with virtually no discomfort or no intimidation of, oh no, I know she's going to want to do that exam.
Right.
We can actually relax and share their concerns. And then as far as, well, what about the actual physical exam? Does the patient come in later for that? Or does that, how does that get done? Most concerns that a woman has that she comes to a gynecologist for actually can be addressed without a pelvic exam. Right?
I know, right? Mind blown, because I think that's obviously that's what everyone thought when I mentioned what you are doing.
And so, for instance, of course, when a woman needs her annual exam, and that is the once-a-year exam where she has to come in for either maybe a pap smear or a pelvic exam. And even pap smears are not needed once every year, which is another common miseducation that is very common in our society, is that you come in every year for your pap smear. Well, pap smears are only needed once every 3 to 5 years, depending on your age and risk factors. So you're really coming in once a year just for a pelvic exam. Outside of that, your visits are as needed and depending on what your concern is. So if a woman's coming in because she's considering changing her birth control, I am not going to find the answer to that in her vagina, I promise. Or if she's coming to me because she is having painful periods, or she is wanting to discuss her sex drive, hormone issues with menopause, she wants to talk about endometriosis, polycystic ovarian syndrome. These are all just big terms that are very, very common concerns that women have from the full age spectrum. And those are conversations. Those are not physical exams. And some things might require an exam or ultrasound or blood work. The majority of that visit is a conversation. And through telehealth, again, because it's so innovative, like the platform that we've been able to create with GAYA Wellness, it blows my mind how many bells and whistles this thing has. I can order labs, I can order medications, I can order images, I can even send lab kits directly to my patient's home.
Wow.
So that they can do their own testing with salivary testing or with like a small pinprick. But there's really the element of, oh, well, for that you need to come in, is completely removed, so that the very few instances a patient does need to come in will be limited to, like, if they have a specific lesion or something physically actively going on that they want to come in and be seen for, which is fine. And that's great. For those visits, we have still our in person, but the focus being on the virtual element of it makes it so much easier for the patients so that they can feel comfortable with the doctor. They get to know the doctor. They get to scope them out, because we love doing our reviews and doing our research before we come in, right? So this gives them an opportunity to scope out the physician, make sure it's a good click. They get to have their story told without being interrupted, without being, rushed along. They get explanations and education and all of their options addressed. They get orders for any labs, any imaging that might need to be done have been done anyways. And now they're already prepped when they come in for their visit in person, so that it's not a, well, now we're going to do all that, and now we're going to have you come back, and now we're going to see you the third time so that we can actually talk about your options. It's getting them prepared so that they are ready to hit the ground running when they're actually seen in person.
Well, that's so much more productive, right? I mean, that allows you to be more productive with more patients. It allows, from a time perspective, them to be more productive with their time with you. One of the things I hate about going to the doctor's office is they ask me the same damn question 75,000 times, and then the doctor comes in and asks me the exact same
questions.
So it's that whole process could be cut. Especially in the scenarios that you're talking about, you still have to ask the questions. I understand that, but I feel like sometimes half of my visit, 3/4 of my visit is repeating the same thing over and over and over again.
Absolutely. And I am a huge, one of my pet peeves is when we do things just because the way they've been done, or we do things inefficiently because no one's bothered to stop and think, how can we do them a little bit more efficiently? Like, let's think about how we can speed this process up. You know, somebody thought about that when they were looking at Uber, right? And
that's correct. Forward thinking.
I remember when the first time somebody suggested calling an Uber, I must have been in my mid-20s, and I was like, you want me to put my credit card information into some phone, and then wait for some rando to show up in a random car, and then get into that car by myself, and you're telling me this is going to be all legitimate? This is never going to work.
No, you would never, ever think of it. It sounded crazy. You would get a taxi if that's really what you wanted.
Right.
And even those were a challenge. Yes, it's forward thinking. You know what I love? And then I want you to, we have to wrap it up. I want people to know how to reach you. But what I love is the word, well, I know Gaia, and if you don't know what that is, Google it. But I love the word wellness, because that implies a whole person. That implies all of you, instead of it just being that minute, okay, what are you here for? I got a sore throat. Okay, here's an antibiotic for 3 days. Call me back in a week when you've it is a relationship, I feel like, that you are establishing, a real relationship with your patients. And as a patient, that is so important to me. And I know it's important to the women that you serve. All right, tell us how they can find you, how they can sign up, how they can get more information, how you, Dr. Patel, can be their doctor.
Awesome. Well, first and foremost, the website's actually scrolling on the bottom. So it's www.GAYAWellness.org. O-R-G. Careful not to go to .com. That is another website altogether. And then the website itself is pretty self-explanatory. It's an integrated telemedicine platform. You log on, you create an account, you fill out some basic questionnaire once, not 15 times. And then you pick a time slot of when you want an appointment. You pick which kind of an appointment you want, because we, like you were saying earlier, we're in comprehensive wellness. So we do behavioral health, weight management, hormonal balance, gynecology, and then down the line, maternity care as well. So you pick your appointment type, you pick your date, you pick your time, and then that's it. Next time you come on for your appointment and you directly interact with the doctor. And in this case, me. And that's as easy as that. If you want to find out more information about it as well, we have our social media platforms. We have Facebook, Instagram, and LinkedIn, Snapchat, TikTok, all of them.
I love it.
So many of them.
I appreciate you. And I want you guys go to GAYAWellness.org. It's scrolling. But the way that you are with me, the way that you are in general, this is the way you are. And so I think because doctors tend to intimidate people, they're intimidated by them. What I love is that you just really build a rapport with people in general. And that is so important, especially when you're talking about things that you're going through. You want to have a medical professional who can actually listen to you and will listen to you, the whole you, that what's going on. You know, I adore you and appreciate you so much. Thank you so much for coming on the show. All right, so now you got the 411 and you got some pictures too, so we'll have to go back to that. And I'm very excited and proud of you, because this is just an amazing thing. So go to GAYAWellness.org. You can reach out to me. You can find Gaia Wellness on all your social media platforms. Thank you for being such an amazing human being and for doing all you do for our community.
Right back at you, Ted.
All right. We'll see you guys soon. Reach out.